Amoxicillin. Amoxicillin is the foundational pillar of primary care, often serving as the first line of defense when a persistent infection takes hold. When a throat becomes so inflamed it feels like swallowing shards of glass, or a deep earache begins to throb, bacteria have likely established a colony within your tissue. Amoxicillin functions as a tactical saboteur. It identifies a specific protein that bacteria require to assemble their protective outer casing. By intercepting this construction, the medication leaves the invaders without their essential armor, causing them to burst and dissolve under their own internal pressure. This specific biological interference is what makes the drug so devastating to the pathogen while remaining safe for the patient. The true power of this antibiotic lies in its biological precision. It targets structures found exclusively in bacterial cells, allowing it to circulate through your bloodstream and neutralize invaders without damaging your healthy human tissue. Because it is highly effective against common pathogens and typically gentle on the digestive tract, it remains the primary tool for everything from acute sinus pressure to painful dental abscesses. For minor cases, a standard dose is 500 milligrams, though for more aggressive infections, doctors frequently prescribe 875 milligrams twice daily to ensure total elimination. It is a time-tested, reliable weapon that continues to lead the fight against modern bacterial threats. Azithromycin, a standard 10-day antibiotic course, often feels like a logistical burden that many patients struggle to complete in their busy lives. Azithromycin, famously known as the Z-Pak, revolutionized treatment by condensing a full recovery into a brief 5-day window. This efficiency is driven by an extraordinary half-life. While most drugs exit the system within hours, azithromycin is engineered to be absorbed by your white blood cells, which transport the medication directly to the infection site. This delivery system ensures that even after the final dose on day 5, the medicine remains active in your tissues, continuing to neutralize bacteria for several days following treatment. This persistent action provides an invisible shield that guards your body long after the pills are gone. Due to this convenience, it is one of the most frequently prescribed solutions for respiratory issues like bronchitis or walking pneumonia. A standard course typically initiates with 250 milligram tablets on the first day, followed by a single daily tablet for the remaining duration. However, this ease of use has led to frequent misuse for viral infections like the common cold or flu. Antibiotics cannot kill viruses, and utilizing a Z-Pak unnecessarily only trains bacteria to become superbugs, making future health crises much more difficult for doctors to manage. Understanding when to use this powerful tool is the key to preserving its effectiveness for the future. Amoxicillin and clavulinate bacteria are not passive victims. They are constantly evolving to survive our strongest medicines. Some bacteria have learned to produce a specific enzyme called beta-lactamase, which acts like a pair of molecular scissors that shreds ordinary amoxicillin before it can work. This is why Augmentin was created. It combines amoxicillin with clavulinate, a substance that doesn't kill bacteria itself, but instead acts as a suicide bodyguard. Clavulinate attracts and traps those bacterial scissors, sacrificing itself so that the amoxicillin can slip past the defenses and finish its mission. This brilliant chemical strategy ensures the drug remains effective even when the invaders try to cheat. This combination is the preferred choice for difficult infections, such as a deep bite from a cat or dog, or a sinus infection that refuses to clear up. Animal mouths contain specialized bacteria that thrive in environments without oxygen, and they are often resistant to basic antibiotics. A typical high-strength dose is 875 milligrams of amoxicillin paired with 125 milligrams of clavulinate. While it is incredibly effective, the addition of clavulinate can sometimes be a bit tougher on the digestive system than amoxicillin alone. Taking it with food is a simple, effective way to help your stomach handle this powerful upgraded defense while it clears your infection. Cephalexin, a minor 0.5-inch scratch while pruning the roses, or a small incision from a routine outpatient procedure might seem insignificant, but for bacteria like Staphylococcus, it is an open invitation. Once these germs breach your skin's outer barrier, they can trigger cellulitis, a condition where your skin becomes swollen, tight, and painfully hot to the touch. Cephalexin, often known by the brand name K-Flex, is the primary specialist for these surface-level invasions. By disrupting the final stage of bacterial cell wall synthesis, cephalexin effectively causes the structural framework of the invading germs to collapse before they can spread into your deeper tissues. Because skin infections thrive in high-humidity environments where sweat can trap pathogens against a wound, maintaining a consistent level of medication is crucial. Doctors typically prescribe a regimen of 250 or 500 milligrams taken 4 times a day to ensure the protective barrier in your bloodstream never falters. It is remarkably efficient at clearing up everything from infected hair follicles to post-surgical redness, provided the patient completes the entire course. While the medicine works internally to dismantle the bacteria's defense, keeping the area clean and dry on the outside remains the most vital habit to prevent the infection from returning or worsening. Doxycycline, hidden in the lush forests of the Northeast, from Connecticut to New York, are tiny ticks no larger than a pinpoint that carry a profound neurological threat, Lyme disease. This is where doxycycline proves its worth as more than just a common treatment for severe acne or skin flare-ups. Unlike many other antibiotics that only attack the outside of a germ, doxycycline has the unique ability to penetrate deep inside the bacteria's own cells to shut down their internal protein factories. This internal sabotage is critical for stopping the Borrelia bacteria, which are notorious for hiding within human tissues and causing long-term nerve pain or chronic fatigue if left unchecked. The timing of this treatment is often a race against the clock for your long-term health. If you notice a bullseye rash larger than 2 inches in diameter after a hike, a single 200 milligram dose of doxycycline given within 72 hours of a tick bite can often prevent Lyme disease before it even starts. Beyond tick-borne illnesses, its versatility makes it a staple in American clinics for everything from respiratory infections to persistent dental issues. Because it works so deeply within the cell, it provides a level of protection that surface-level antibiotics simply cannot match, ensuring that invaders are neutralized before they can cause permanent damage to your peripheral nervous system or disrupt your daily energy levels significantly. Sulfamethoxazole and trimethoprim. For anyone who has experienced the sudden, searing pain of a urinary tract infection, the arrival of a prescription for Bactrim, a combination of sulfamethoxazole and trimethoprim, is a massive relief. This medication employs a double-hit strategy that is far more effective than either drug used alone. Bacteria require a steady supply of folic acid to reproduce their DNA, and this antibiotic duo acts as a strategic blockade. By cutting off 2 separate steps in the bacteria's folic acid production line, Bactrim essentially starves the invaders of the essential nutrients they need to multiply. This chemical blockade is so thorough that it can clear up a painful infection within just a few days, often using a standard double-strength DS tablet containing 800 milligrams of sulfamethoxazole and 160 milligrams of trimethoprim. However, this power comes with a significant caution that every patient should be aware of. Sulfa allergies are among the most common adverse drug reactions in the United States, often causing hives, swelling, or a sudden, itchy rash. It is a potent reminder that while this double punch is incredibly effective at restoring your quality of life and preventing serious kidney complications, it must be handled with respect for your body's individual chemistry to ensure your circulation remains clear of both germs and harmful reactions. Modern clinicians rely on this synergy to tackle resistant strains that other medications might miss entirely, making it a cornerstone of effective outpatient care. Nitrofurantoin. Most antibiotics act like a broad broadcast, traveling through every inch of the bloodstream and often disrupting the delicate bacterial balance in the gut. Nitrofurantoin, known by the brand Macrobid, serves as a specialized exception by functioning as a targeted strike. After swallowing a 100 milligram capsule, the body rapidly filters it through the kidneys, which act as a high-speed transit system. The kidneys flush the medication directly into the bladder. This allows the drug to reach incredible concentrations exactly where the infection lives, while leaving the rest of the body's healthy microbiome virtually undisturbed. by focusing solely on the urinary tract, prevents the widespread disruption often seen with other oral medications. This specialized delivery is why Macrobid is the primary choice for simple bladder infections, as it minimizes systemic side effects like fatigue or digestive distress. It operates by attacking multiple targets inside a bacterial cell at once, from its DNA to its energy-producing enzymes, making it extremely difficult for germs to survive or adapt. For the average adult, a twice-daily dose for 5 days effectively clears persistent urinary discomfort and prevents the infection from ascending to the kidneys. By concentrating its strength only where it is required, nitrofurantoin provides a clear example of how medical precision can protect overall wellness while resolving a localized infection effectively. Ciprofloxacin. Certain medical crises require a weapon so powerful it carries its own significant risks, and ciprofloxacin, or Cipro, exists at this exact intersection. This drug belongs to the fluoroquinolone class, which targets the genetic core of a bacteria by preventing it from uncoiling its DNA to reproduce. Without the ability to read its own genetic instructions, the bacteria cease to function and die. However, this profound interference comes with an FDA black box warning, the most serious safety alert a medication can receive. This mechanism can occasionally impact the collagen in human connective tissues. In rare instances, this leads to life-altering complications like a ruptured Achilles tendon or permanent nerve damage. This warning is a critical reminder that medical power must be managed with extreme vigilance. Due to these specific risks, Cipro is strictly reserved for cases where no safer alternative exists, such as complex kidney infections or potential anthrax exposure. A standard prescription is often a 500 milligram dose taken twice daily, with strict medical advice to avoid strenuous physical activity to protect the tendons from stress. It is a vital tool that can halt an escalating infection, but it demands an extreme level of caution from both doctors and patients during the entire treatment window. When a medical authority emphasizes using a drug only when necessary, ciprofloxacin is the reason why, serving as a reminder that our most potent tools must be used with total precision to balance survival with long-term physical safety and integrity. Levofloxacin. When a respiratory infection turns critical and pneumonia begins to restrict oxygen levels in the blood, every minute counts for the patient's survival. In these high-stakes scenarios, levofloxacin acts as a reinforced defense for the lungs. It is a more potent, evolved version of ciprofloxacin, specifically enhanced to penetrate deep into respiratory tissues. In a clinical setting, seeing a patient's oxygen saturation drop below 92% creates an immediate need to clear the lungs of fluid and pathogens. Levofloxacin provides this rapid response by flood-loading the system. A high-dose, once-daily 750 milligram hit can stabilize breathing within hours, often preventing the need for more invasive procedures. Nursing staff monitor this treatment intensely due to its extreme strength and potential for rapid changes in the patient's condition. Because it shares the same structural framework as Cipro, doctors must weigh the risk of tendon or nerve issues against the immediate threat of respiratory failure. It is a calculated decision for survival, typically reserved for those hospitalized with underlying conditions that make an infection life-threatening. The objective is to clear the lungs so effectively that the patient can return to breathing room air without mechanical assistance or long-term damage. Levofloxacin is the heavy-duty engine in emergency medicine that pulls patients back from the brink, proving that aggressive infections require an equally aggressive and precise clinical response. Clindamycin serves as a vital safeguard for individuals with severe penicillin allergies who need reliable antibiotic protection. Consider a painful, throbbing dental abscess, where bacteria have burrowed deep into the jawbone, an area where oxygen is scarce and most antibiotics fail to penetrate. Clindamycin excels here by invading the bacteria's ribosomes, the microscopic engines that produce the proteins needed for life. By turning off the bacteria's internal power supply, clindamycin neutralizes the most dangerous anaerobic germs hiding in your bones. This ability to work in low oxygen environments makes it a critical tool for oral and orthopedic surgeons alike. Whether treating a resistant skin infection or a complex bone issue, clindamycin is often the specialist called to resolve the crisis. A typical outpatient dose is 300 milligrams taken every 6 hours, to maintain high blood levels around the clock and ensure continuous suppression. The success of this treatment depends on completing the entire prescription without missing a single dose. Stopping early can lead to a dangerous secondary condition called C. diff, which complicates the recovery significantly. Ending your antibiotic journey correctly is the final step. It ensures that these medical tools continue to work for generations to come. If you found this breakdown helpful for your health journey, please consider subscribing to stay informed on how to protect your circulation and nerves. Thank you for watching and for taking proactive steps toward a healthier you.